Question 1. UAP asks to assist with applying sequential compression devices. What should the RN do? A. Allow it with supervision and instruction. B. Delegate without further input. C. Ask the LPN to perform it instead. D. Decline due to complexity. Answer. A. Allow it with supervision and instruction. Question 2. Which client should be seen first? A. Client with for infiltrated and mild swelling. B. Client with complaints of itching from a rash. C. Client post-abdominal surgery reporting sudden shortness of breath. D. Client waiting for discharge paperwork. Answer. C. Client post-abdominal surgery reporting sudden shortness of breath. Question 3. What is a key sign of effective delegation? A. Staff completes task without follow-up. B. The task is completed accurately and timely. C. The RN avoids all direct involvement. D. The task is reassigned mid-shift. Answer. B. The task is completed accurately and timely. Question 4. A nurse assigns a UAP to assist with feeding. What instruction is most critical? A. Be sure to chat with the patient. B. Sit them up before feeding. C. Feed the client quickly. D. Offer a dessert first. Answer. B. Sit them up before feeding. Question 5. What is an appropriate task for the LPN? A. Teaching diabetic foot care. B. Performing an initial post-op assessment. C. Reinforcing dietary education for hypertension. D. Creating a discharge plan. Answer. C. Reinforcing dietary education for hypertension. Question 6. What is the RN's priority after delegating to a new UAP? A. Complete the task again later. B. Supervise and validate proper completion. C. Let the charge nurse follow up. D. Reassign duties to the LPN. Answer. B. Supervise and validate proper completion. Question 7. Which task should not be assigned to a UAP? A. Recording intake and output. B. Assisting with toileting. C. Monitoring blood transfusion reaction. D. Assisting with grooming. Answer. C. Monitoring blood transfusion reaction. Question 8. A client's family is upset that a UAP is helping their loved one. What is the best response? A. The UAPs are well trained. B. I will assess the care myself. C. Let me explain the role of our UAPs. D. Would you prefer to request a transfer? Answer. C. Let me explain the role of our UAPs. Question 9. The RN delegates vital signs for a new post-op client. What is most appropriate? A. Ask the UAP to notify the provider. B. Assume the results are normal. C. Review and validate the findings. D. Delegate interpretation to the UAP. Answer. C. Review and validate the findings. Question 10. Which task is within the UAP's role? A. Interpreting telemetry strips. B. Collecting a routine stool sample. C. Initiating fall precautions. D. Reinforcing education on medications. Answer. B. Collecting a routine stool sample. Question 11. A nurse asks a UAP to ambulate a client, who later falls. What's the first step? A. Complete an incident report. B. Assess the client's condition. C. Ask the UAP what happened. D. Call the provider. Answer. B. Assess the client's condition. Question 12. Which action requires immediate RN intervention? A. UAP reports a patient is sleeping. B. LPN documents wound drainage as serous. C. UAP assists a client with swallowing precautions. D. LPN titrates a vasoactive drip. Answer. D. LPN titrates a vasoactive drip. Question 13. Who should be assigned to the UAP? A. A client who needs 4 antibiotics. B. A client with dementia who needs feeding. C. A client complaining of chest tightness. D. A client scheduled for a procedure requiring consent. Answer: B. A client with dementia who needs feeding. Question 14. What is the first thing a nurse should check before delegating a task? A. The UAP's schedule. B. The UAP's years of experience. C. The facility's policy on delegation. D. The nurse's preferences. Answer: C. The facility's policy on delegation. Question 15. A nurse delegates to a UAP but later finds the task incomplete. What should be done? A. Redo the task quietly. B. Address it privately and provide feedback. C. Report directly to administration. D. Remove the UAP from future assignments. Answer: B. Address it privately and provide feedback. Question 16. Which client is appropriate for the LPN? A. A client with a new chest tube. B. A client receiving for dopamine. C. A stable client requiring dressing change. D. A client scheduled for complex wound debridement. Answer: C. A stable client requiring dressing change. Question 17. What is a critical component of safe delegation? A. Letting UAPs interpret lab results. B. Ensuring the UAP reports abnormal findings. C. Asking the UAP to explain medical terms. D. Allowing the UAP to create care plans. Answer: B. Ensuring the UAP reports abnormal findings. Question 18. A client is refusing care. What should the RN do first? A. Ask the UAP to document it. B. Notify the physician. C. Assess the client's reason for refusal. D. Try again later, without explanation. Answer: C. Assess the client's reason for refusal. Question 19. What is the best example of indirect delegation? A. Assigning ambulation to a UAP. B. Assigning med passes to an LPN. C. Outlining UAP responsibilities in written protocols. D. Observing the UAP perform oral care. Answer: C. Outlining UAP responsibilities in written protocols. Question 20. Which client should the RN assess first? A. Client with potassium 4.0 milliequivalent/L. B. Client reporting palpitations and lightheadedness. C. Client with blood sugar of 150 milligrams per deciliter. D. Client who wants assistance with dressing. Answer: B. Client reporting palpitations and lightheadedness. Question 21. A client becomes acutely short of breath. What is the nurse's immediate action? A. Call respiratory therapy. B. Raise the head of the bed. C. Notify the provider. D. Check the client's pulse. Answer: B. Raise the head of the bed. Question 22. The RN assigns a stable diabetic patient to the LPN. Which task is most appropriate? A. Administering sliding scale insulin. B. Teaching dietary carbohydrate counting. C. Reviewing long-term complications. D. Adjusting insulin regimen. Answer: A. Administering sliding scale insulin. Question 23. UAP is helping a client with ambulation. Which instruction by the RN is essential? A. Use a gait belt and stand on the client's weak side. B. Ask the family to observe. C. Be sure to walk quickly to avoid fatigue. D. You can leave the client alone if they feel strong. Answer: A. Use a gait belt and stand on the client's weak side. Question 24. Which action by the LPN requires intervention by the RN? A. Performing a dressing change on a chronic wound. B. Administering an oral antihypertensive. C. Starting in 4 on a new admission. D. reinforcing discharge teaching. Answer: C. Starting in 4 on a new admission. Question 25. Which task is appropriate for delegation to a UAP? A. Checking the apical pulse. B. Assisting a client with a bedpan. C. Teaching incentive spirometer use. D. Evaluating fluid balance. Answer: B. Assisting a client with a bedpan. Question 26. What must the RN assess before assigning a task? A. Client's insurance status. B. Team members' availability. C. Team members' legal scope of practice. D. Client's dietary preferences. Answer: C. Team members' legal scope of practice. Question 27. A UAP tells the RN that they forgot to reposition a client. What is the RN's priority response? A. Report the UAP to the manager. B. Reassign the UAP's responsibilities. C. Reinforce the importance of timely repositioning. D. Complete the repositioning and move on. Answer: C. Reinforce the importance of timely repositioning. Question 28. Which action by the nurse demonstrates accountability in delegation? A. Assuming the UAP understands client safety needs. B. Following up to ensure the task was completed correctly. C. Documenting task assignment and moving on. D. Letting the UAP determine the timing of the task. Answer: B. Following up to ensure the task was completed correctly. Question 29. A confused client tries to pull out their 4. What is the most appropriate nursing action? A. Apply soft restraints immediately. B. Ask the UAP to sit with the client. C. Notify the provider for a restraint order. D. Assign the client to a private room. Answer: B. Ask the UAP to sit with the client. Question 30. Which task should the RN delegate to the LPN? A. Developing a care plan. B. Performing the initial physical assessment. C. Administering oral medications to a stable client. D. Providing discharge instructions for a new diagnosis. Answer: C. Administering oral medications to a stable client. Question 31. A UAP is helping a client with right-sided weakness. What instruction ensures safety? A. Support the client on the left side. B. Walk on the client's right side. C. Use a transfer belt and stay at the weak side. D. Let the client walk alone if they feel able. Answer: C. Use a transfer belt and stay at the weak side. Question 32. Which of the following cannot be delegated by the RN? A. Measuring urine output. B. Assisting with ambulation. C. Administering subcutaneous insulin. D. Evaluating the effectiveness of pain medication. Answer: D. Evaluating the effectiveness of pain medication. Question 33. The RN receives a shift report. Who should be assessed first? A. A client with a chronic pressure ulcer. B. A client reporting chest heaviness. C. A client due for discharge. D. A client with a scheduled blood draw. Answer: B. A client reporting chest heaviness. Question 34. A nurse delegates blood glucose checks to a UAP. Which instruction is correct? A. You can administer insulin if the glucose is high. B. Report any glucose level above 150 milligrams per deciliter. C. Skip checks if the client is sleeping. D. Notify the LPN only if it's below 90 milligrams per deciliter. Answer: B. Report any glucose level above 150 milligrams per deciliter. Question 35. A UAP tells the RN a client's blood pressure is 88/60 mmHg. What should the nurse do first? A. Ask the UAP to recheck it. B. Document the findings. C. Go assess the client immediately. D. Give 4 fluids. Answer. C. Go assess the client immediately. Question 36. Which task is within the LPN scope? A. Initiating total parenteral nutrition. B. Providing education on new antihypertensive medication. C. Reinforcing teaching on medication adherence. D. Adjusting a PCA pump dose. Answer. C. Reinforcing teaching on medication adherence. Question 37. What is the best strategy to ensure tasks are delegated effectively? A. Delegate all non-critical tasks. B. Match the task with the team member's skill and legal role. C. Rotate responsibilities evenly. D. Assign based on personal preferences. Answer. B. Match the task with the team member's skill and legal role. Question 38. A nurse delegates weight measurement to a UAP. What is the nurse's follow-up responsibility? A. Nothing if the weight is within normal range. B. Document the weight. C. Interpret the weight and assess for fluid status. D. Ask the UAP to document trends. Answer. C. Interpret the weight and assess for fluid status. Question 39. What is the most appropriate task for the LPN? A. Completing the admission assessment. B. Administering 4-push pain medication. C. Reinforcing dietary teaching for a cardiac diet. D. Adjusting oxygen flow for a client in distress. Answer. C. Reinforcing dietary teaching for a cardiac diet. Question 40. A UAP is caring for a client on contact precautions. Which action requires intervention? A. Wearing gloves and gown. B. Bringing a stethoscope from the hallway. C. Hand hygiene before and after contact. D. Using disposable equipment. Answer. B. Bringing a stethoscope from the hallway. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.